I don't think that you can overserve people. Hi, my name is Dave Eggert. I'm an orthopedic surgeon in Appleton at OSI. I'm originally from West Bend, Wisconsin, and I went to Ripon College, and unfortunately the second year I played basketball at Ripon, I tore my ACL. And I needed some surgery. I was introduced to an orthopedic surgeon, and he was a great role model for myself. I went 4 years of medical school, fortunately got accepted to a residency in orthopedics down in Milwaukee. Went 5 years there, and then I've spent, the last 20 years here in the Valley. It's fun talking to former athletes because, they think about the same things that I think about and that I've experienced in my life. My kids are athletes, and so on vacations, I'll hit a tennis ball around with them. I don't play basketball anymore, but I bought all of them road bikes and we go biking together. I swim. I love to interact with people. I like to get to know them. That's just who I am. I love to talk to people. I love to talk to people on the phone. I love to ask what people are thinking. I mean, that's just who I am. That's the fun thing about taking care of patients, is creating relationships, getting to know patients, knowing that I can possibly help them the rest of their life. One of the principles that I think about frequently, because I take care of young athletes, is how would I treat that patient as if it was my son or my daughter? I don't think that you can overserve people. As far as operating on procedures that we typically did as inpatients, and what we're talking about are partial knee replacements, hemiarthroplasties, we've started doing this. The first patient that I had, was a 78-year-old lady, and her name was Marion. One of the 3 compartments in her knee had a problem. She was a perfect candidate for a partial knee replacement. I said, "What do you think about this?" And she said, "Dr. Eggert, I'd love to do this. Just think of me as being a pioneer." She was so excited about it, but the neatest thing was that she did such a great job. She came in 3 days after her procedure. And I said, "Miriam, where are your crutches?" And she said, "Dr. Eggert, I forgot my crutches." I took her by her hand and I led her throughout the entire building, showing her off. She was emotional. She was so thankful of what was going on, both she and her husband, but she had a great result, and these are some of the things that we're going to be doing. We're going to change the way that we've done medicine in the past.